One of the symptoms after knee replacement which patient always complains about is that the feet are warm and he feels cold in that limb. Now this phenomenon occurs because of circulatory changes in that leg. Basically, whenever there is knee replacement, there are soft tissue which are cut and sutured, and there is implant, that is hardware inside the knee joint. So their feet will feel warm because the circulation in that leg is increased. There is also some reactive hyperemia, that means there is some reactive increase in blood flow which leads to warmth in the leg. But the patient will feel that the leg is cold because the heat loss occurs because of excessive circulation in that leg. This is a normal phenomenon, normally occurs around 6 weeks to 8 weeks after the surgery, and it can last up to 6 months depending upon how much the patient has reacted to the surgery and to the implant. The only thing to worry about if this phenomenon continues for a long time is to rule out infection with the help of blood markers. Otherwise, there is nothing to worry about, and continued exercises and routine therapies like icing will help in getting rid of this condition. Thank you.